The White House just announced changes that could put an extra $200 to $400 per month directly into Social Security recipients' pockets starting in 2026. This isn't speculation or wishful thinking. These are real proposals that could reshape retirement income for over 67 million Americans. Whether you're already collecting benefits or planning for retirement, what happens in the next 18 months will determine how much money lands in your bank account each month for the rest of your life. Stay with me, because the details I'm sharing today could be worth thousands of dollars to your family. I'm Terry, and I break down Social Security and Medicare updates in plain English. I've spent the last 8 years helping seniors navigate government benefits, and I make it my mission to cut through the political noise and give you the facts that actually matter to your monthly check. Welcome back to everyone who's been following along, and if you're new here, you're in the right place for straight talk about your benefits. Before we dive in, drop a comment and let me know your state. I'm curious where everyone's watching from today, and it actually helps me understand which state-specific rules might affect you most. Here's what we're covering today, and trust me, you'll want to stick around for all 5 points. First, the proposed COLA boost and how they want to change the annual cost of living calculation to put more money in your pocket. Second, the earnings cap elimination and why high earners might finally pay Social Security taxes on their full income and how that helps everyone. Third, the Caregiver Credit proposal and how years spent caring for family could count toward your benefit calculation. Fourth, Medicare Part B premium relief and a plan to stop those premiums from eating up your Social Security increases. Finally, the timeline and reality check about when these changes could actually happen and what obstacles they face. Right now, your annual Social Security cost of living adjustment is based on something called the Consumer Price Index for urban wage earners. That's a mouthful, but here's the problem. It measures what working-age people buy, not what seniors actually spend money on. The White House proposal would switch to the Consumer Price Index for the elderly, which tracks senior spending more accurately. The difference comes down to healthcare costs, prescription drugs, and housing expenses that eat up most of your budget. Here's a real example of how this matters to your wallet. Under the current system, if general inflation is 3%, your COLA might be 3.2%. But senior-specific inflation often runs higher because medical costs rise faster than other prices. With the new calculation, that same year might generate a 4.1% increase instead. For someone receiving $1,800 per month right now, that's the difference between a $58 increase and a $74 increase, an extra $192 per year. Over a 20-year retirement, that compounds to thousands more in your pocket. This is a proposal, not law yet, and it needs congressional approval while facing resistance from those worried about program costs. The second major change involves making high earners pay their fair share into the system. Currently, Social Security taxes stop at $160,200 in income. Earn more than that? You don't pay Social Security taxes on the excess, and those earnings don't count toward your future benefits either. The proposal would eliminate this cap entirely, meaning everyone would pay the 6.2% Social Security tax on their full income, no matter how much they make. This doesn't directly increase your monthly check, but it strengthens the entire system's finances. A stronger Social Security system means more secure benefits for everyone and potentially room for the other improvements we're discussing. Here's the math that matters. Someone earning $500,000 per year currently pays Social Security taxes on only the first $160,200. Under the new rule, they'd pay on all $500,000. That's an extra $21,233 per year flowing into the Social Security Trust Fund from just one high earner. The Congressional Budget Office estimates this change alone would extend Social Security solvency by approximately 12 years. For you, that means decades of guaranteed benefits instead of the current projected shortfall in 2034. Again, this is a proposal requiring congressional action. The third proposal addresses something that's affected millions of Americans, mostly women, who have gaps in their Social Security earnings records because they left work to care for children, parents, or disabled family members. These zero earnings years drag down benefit calculations significantly. The White House wants to create caregiver credits that would count these years as if you earned a modest income, preventing them from appearing as zeros in your benefit calculation. Your Social Security benefit is based on your highest 35 years of earnings. So if you only worked 30 years because you spent 5 years caring for an aging parent, those 5 zero years currently pull your average way down. Let's say your average monthly earnings over 30 working years was $4,000. With 5 zero years factored in, your average drops to about $3,430, reducing your monthly benefit by roughly $180 per month or $2,160 per year. The caregiver credit would assign a value, likely around $15,000 per year, to those caregiving years. Instead of zeros, you'd have modest positive earnings that keep your benefit calculation higher. For someone affected by this, it could mean an extra $150 to $300 per month in Social Security benefits, real money that recognizes the economic value of caring for family members. This is a proposal that would need new legislation to implement. The fourth change tackles a frustrating reality that many of you experience every year. Medicare Part B premiums often rise faster than Social Security cost of living adjustments. You get a 3% Social Security increase, but your Medicare premium goes up $15 per month, wiping out most of your raise. The proposal includes premium relief that would limit how much Medicare Part B premiums can increase relative to Social Security COLAs. Essentially, they want to ensure your Medicare premium increases never exceed your Social Security increases. Currently, Medicare Part B costs $174.70 per month for most people. If it jumps to $190 next year, while Social Security only increases by 2.5%, you're actually losing money despite the so-called raise. Under the proposed system, Medicare premium increases would be capped, so your net Social Security payment always goes up, never down due to Medicare costs. For the average recipient, this protection could preserve $200 to $400 annually that currently gets lost to premium increases. Over a 20-year retirement, that's $4,000 to $8,000 staying in your pocket instead of going to Medicare premiums. This requires coordination between Social Security Administration and Medicare, making it a complex proposal needing multiple agency changes. Before we get to the timeline and reality check, I want to hear from you. If these changes went through and you had an extra $200 per month, what would make the biggest difference in your life? Help with groceries, covering prescription costs, or having a little cushion for emergencies? Drop your answer in the comments because I read every single one. Now, for the hard truth about timing and political reality. These are proposals from the White House, but they need congressional approval to become law. Some are more likely than others, and understanding the political landscape helps set realistic expectations. Medicare premium relief coordination could happen through administrative action, and some caregiver credit provisions might get bipartisan support since caring for family members resonates across party lines. COLA calculation changes have been proposed before and have some bipartisan interest because the math makes sense, but implementation is complex and requires significant system changes. The biggest political challenge is eliminating the earnings cap, which faces the strongest resistance from high earners and business groups who oppose it heavily. However, it polls well with the general public who see it as a fairness issue. The 2024 election results will heavily influence what actually moves forward, since congressional composition matters more than presidential preferences on Social Security issues. If any of these pass, implementation would likely begin in 2026 at the earliest. Social Security changes typically get long lead times to allow system updates and public preparation. What you can count on is that regular COLA adjustments will continue under current law. Core Social Security benefits remain protected, and Medicare continues regardless of these specific proposals. What to watch for includes congressional hearings on Social Security reform, bipartisan working group formations, and state-level advocacy efforts that often signal momentum for federal changes. Whether these specific changes happen or not, the discussion signals increased attention to Social Security adequacy, which is good news for current and future beneficiaries. If you're already collecting benefits, continue planning based on current law, since any improvements would be welcome bonuses. Stay informed, but don't dramatically change spending based on proposals that haven't become law. If you're approaching retirement, remember these changes wouldn't affect current retirees differently than future ones, so focus on maximizing benefits under current rules. Delaying retirement past full retirement age still provides the biggest guaranteed increase you can control. If you're decades from retirement, these proposals suggest stronger political will to improve Social Security over time. Continue contributing and tracking your earnings record while considering these potential improvements as possible bonuses, not guaranteed income. The key is building a retirement plan that works under current law and can benefit from improvements if they happen. For reliable information, stick to the Social Security Administration's official website at ssa.gov, Congressional Budget Office reports on Social Security, and AARP's policy analysis regardless of membership status. Your local Social Security office can answer personal questions about your specific situation. Avoid anyone promising guaranteed benefit increases, services charging fees to optimize your Social Security, and dramatic claims about Social Security collapse. These are red flags that indicate unreliable sources. You can make your voice heard by contacting your representatives about Social Security priorities, joining advocacy organizations that align with your views, and voting in all elections, including local ones, where Social Security advocates often start their careers. Create a My Social Security account at ssa.gov. If you haven't already, review your annual Social Security statement for accuracy. Understand your full retirement age and benefit calculations, and consider consulting a fee-only financial planner for retirement timing questions. Let's quickly recap what the White House is proposing. They want a better COLA calculation that reflects senior spending patterns, higher earners paying Social Security taxes on their full income, credits for caregiving years that currently show up as zeros, Medicare premium protections that preserve your Social Security increases, and a stronger overall system that can support these improvements. Will all of this happen? Probably not exactly as proposed. Will some version of improvements happen? The political momentum suggests yes, especially given Social Security's popularity across party lines. The most important thing you can do is stay informed with reliable sources and understand how current law affects your situation. These proposals, if they happen, would be improvements to a system that's already working for 67 million Americans. Thanks for watching and trusting me to break this down for you. If this helped clear up the confusion around these proposals, hit the like button and subscribe for more straight talk about your benefits. Share this with anyone in your family who needs to understand these potential changes. Next week, I'm covering the latest Medicare Advantage changes for 2025 and how they might affect your healthcare costs. You won't want to miss that one. I'll see you then.